Angelina Jolie taking matters into her own hands once again. The Oscar-winning actress, who already underwent a double mastectomy, says she has now had her ovaries and fallopian tubes removed in hopes of reducing her risk of cancer. Hi, I'm Carolyn Costello in New York. Here with more is ABC's Karen Travers. Karen, Jolie revealed her latest cancer-preventing procedure in the same way she went public with her double mastectomy 2 years ago. Isn't that right?
Caroline, this seems to be Angelina Jolie's way. An essay in the New York Times, just how she did that nearly 2 years ago when she talked about her mastectomy, did it with little fanfare. It appeared online overnight. She doesn't advertise it ahead of time. That seems to be the way she wants to convey her message. And in that very personal essay, she said that recently she had surgery to remove her ovaries and fallopian tubes after a blood test showed doctors potential signs of early ovarian cancer.
Angelina Jolie with another personal bombshell. In an essay published overnight in the New York Times, the Oscar winner revealed she recently had surgery to remove her ovaries and fallopian tubes after a blood test detected potential signs of early ovarian cancer. I went through what I imagine thousands of other women have felt. I told myself to stay calm, to be strong, and that I had no reason to think I wouldn't live to see my children grow up and to meet my grandchildren. Further tests came back negative for cancer, but the humanitarian and mother of 6 said surgery was her best option. That's because she has an extensive family history of ovarian cancer. Her mother, aunt, and grandmother all died from the disease. She wrote, "It is not possible to remove all risk, and the fact is I remain prone to cancer. Experts say the key is to center in on the fallopian tubes, where ovarian cancer is thought to originate."
By the time of surgery, about 5 to 10% of women with this type of genetic mutation will have a hidden or occult cancer present, so it's important that that surgery is done properly.
It's a straightforward procedure done through a tiny incision and completed in as little as 15 minutes. 2 years ago, Jolie stunned the world when she revealed she had undergone a preventive double mastectomy after testing positive for a gene mutation that put her at a higher cancer risk.
It's connected me so much to other families, other women.
Angelina Jolie closed her essay by noting, "These are not easy decisions, but knowledge is power." Carolyn?
All right, Karen Travers, thank you so much for that. We want to bring in now ABC's senior medical contributor, Dr. Jennifer Ashton, as well as Rene Syler, TV personality and founder of GoodEnoughMother.com, who also underwent a preventative bilateral mastectomy. Jennifer, let's start with you. Jolie said that she did not test positive for cancer, but that she did have certain markers in her blood that raised red flags.
Exactly, and that's what's confusing to so many women and to doctors alike. You know, we have to remember this BRCA mutation. Most people think of the increased risk for breast cancer. We have a screening test for breast cancer. There is no screening test for ovarian cancer, so that is what we call in my specialty of gynecology the silent killer. Typically, when ovarian cancer is detected, whether it's by ultrasound or blood test or by surgery, it is found at an advanced stage where the survival or prognosis tends to be very poor. And we also have to remember that blood tests like Angelina Jolie mentioned, the CA-125 and a pelvic sonogram, they are not accepted screening tests for ovarian cancer, but we use them every day because it's all we have right now.
Is the BRCA gene related to ovarian cancer as well as breast cancer?
It is, exactly correct. It increases a woman's risk for both breast cancer as well as ovarian cancer. And to put that into some numerical context, the average woman has a lifetime risk of facing ovarian cancer of just over 1%. With a BRCA mutation, that risk can be as high as 40%. And then when you have multiple first-degree relatives or family members, it can go even higher. So we're talking about significant risks, and surgery has been conclusively proven to decrease the risk of death from ovarian cancer.
Okay, and Rene, over to you now. Like Angelina, you took matters into your own hands and had prophylactic mastectomy as well. Talk about what led you to make this very big personal decision.
I'm the daughter of not one but 2 breast cancer survivors. So my mother and father both had breast cancer. I was diagnosed with a precancerous condition in 2002 or so, and I've been watching it and kind of waiting. And every year I would have to have, obviously I would have a mammogram, but then I would have a biopsy every year. So in 4 years I had 4 biopsies. And, you know, I just was missing so much breast tissue. They were all in the same location on the same breast. I was missing so much breast tissue. And I really, what this came down to was a quality of life decision. I didn't want to live my life this way. And a lot like in the case with Angelina Jolie, I mean, this is not a decision that was entered into lightly. I really, really struggled with this. I talked to my family. I prayed about it. I did a lot to get to that place. And ultimately, I decided that that was the decision for me, was to have the preventive mastectomy.
And as a woman, what are some of the things you struggle with? What goes through your mind when you think about removing both of your breasts as a preventive procedure?
I think that people, because that's what I got this question a lot. People would say, well, what does your husband say? And I said, well, they're my breasts. You know, I mean, and honestly, you want to know, I didn't struggle with anything because it was a matter of, if a part of me was gone so that all of me could be here and to be here for my family, that was a no-brainer. That didn't, it was the decision for me. And now here I am 7 years out and I'm doing great.
Bravo, Rene.
Yeah.
I completely agree with that, and I hear that from so many women who have made the choice for risk reductive surgery. But I think we also need to be respectful of the women who choose not to have surgery. When you're talking about the BRCA mutation for ovarian cancer risk, about 30% of women choose not to have surgery. That's their choice. I am respectful of that choice. It may not be what I would choose as a woman. It may not be what I would counsel my patients to choose, but we do have to respect that choice as well.
But I think the thing that's frustrating, if I could just get this in, is that what's frustrating is that so many people are making these wild accusations. They have everybody has an opinion. And my only thing is, listen, it's my body. I did what was right for me. It's her body. She did what was right for her. And just like Jen Ashton just said, you know, some people choose not to go that route, but be respectful of everyone's decision. And please be compassionate, please.
Absolutely.
Yep.
I think Angelina Jolie made that point in the op-ed that she wrote, that her choice is not necessarily for everyone, that there are other options out there. I do want to talk about the double mastectomy. It's such an invasive procedure, obviously. A lot more invasive than removing the ovary and the fallopian tubes. But in some ways, removing the ovary and the fallopian tubes is a bigger deal because it causes early onset of menopause.
Correct.
That causes a lot of physical changes.
That is absolutely on point, the way you described it. The mastectomy is a much bigger operation. The recovery is much more intensive and extensive. And then if a woman chooses to have breast reconstruction, that can be months to even up to a year of repeated operations. The removal of tubes and ovaries is a same-day procedure. It's done laparoscopic through tiny little incisions. It can be done in 15 minutes in trained, experienced hands. However, as you said, it places a woman into immediate surgical menopause, and about 75% of women will experience hot flashes. And these symptoms, these menopausal symptoms, should not be diminished. They impact on a woman's quality of life, and so it should be part of the counseling process. There are a range of good options for a woman today, ranging from hormonal therapy to non-hormonal therapy to even some alternative therapies like bee pollen extract, and there is treatment. But this is a big decision, just like a mastectomy is. It's an individual decision, and I agree with Rene. It should be up to the individual woman. It's her body.
I want to ask you about that too, because I remember years ago when my mother was going through menopause, she was afraid to do the hormone replacement therapy. Has it come a long way? Is it safer now? You
know, the pendulum has swung all the way against, and now is kind of coming slightly more back to midline. What we know about hormone replacement therapy is it's not a one-size-fits-all. There is still not enough evidence that bioidentical is safer or more unsafe than traditional therapy. It's a decision that every woman should discuss her own risks with her doctor, but at a young age, 40, there are some real benefits to giving that woman hormonal replacement therapy to her bones, to her overall health, and there are other options.
Right, okay, and you know, you can also put yourself at greater risk for other types of cancers if you don't do the hormone replacement therapy. Is that right?
Well, it's not that you risk other types of cancers. We know that skeletal health, bone health is very, very important. Once you remove the source of estrogen from the ovaries, if you do that at, let's say, age 40, and you have another 40 to 50 years to live, your osteoporosis is a real issue, and it's a life-threatening issue potentially down the road. And there are certain cancers that risk go down with hormone replacement therapy, and some that are thought to go up. So this is a decision that a woman should make with her doctor, because it is not one size fits all. Really, none of medicine is. So that's the beauty of these options, is that there is an option for every woman.
Yeah, it makes you think about how difficult the decision really is when you hear about all the things you have to consider. Rene, I want to ask you, having your preventive surgery, how did it change your life, if at all? Do you think having high-profile women like yourself and, of course, Angelina Jolie going public is making a difference, is helping other women out there?
Gosh, I hope so. You know, I mean, I talked about this from the beginning, from the time that I was having the genetic testing. And by the way, I didn't have the BRCA gene. I did not have the genetic mutation, but obviously something wasn't right since I was having these problems. I do think that the more we talk about it, the more there's a dialogue about it, the closer we get to resolving and having some real answers about this. You know, I mean, the fact is not everybody can afford the surgery that she had and or has insurance like I did, but we should all be able to have a quality of care that assures us a wonderful quality of life. This is why I did this, was because I didn't want to have this thing hanging over my head. And that's the thing. You asked what was different after my surgery. A tremendous amount of relief. That's what was different.
Wow, huge weight off your shoulders, I'm sure. I wanted to ask you, Doctor, just one last question. You know, one of the things that I've read about menopause is that it can cause early aging, or rapid aging rather. A woman starts to age more rapidly, and obviously for Angelina Jolie, I mean, all women are concerned with aging, but you know, this is a beautiful woman who makes her living from being a beautiful woman. That must have been a huge factor for her.
Well, you know, I think it's a factor for everyone, and I want to bring in the non-celebrity, the so-called average woman here, that the fact of the matter is that hundreds and thousands of women have walked in her shoes, have had this surgery. They didn't make front page news. They didn't make television news. They did it bravely and stoically and courageously with the support of their friends and family, just like she did. And they too are concerned with their appearance. And we're living in an age where we all want to look, you know, 20 years old forever. That's not reality. I think aging gracefully and aging healthfully should be the goal. And you have to remember, these operations, like Rene was talking about, like removal of the ovaries and tubes, as Angelina Jolie had, this is to save someone's life. So when you talk about that versus a few wrinkles, even, you know, the most vain woman, I think, will say, you know what? I choose life, and the data is very clear. Removal of the tubes and ovaries saves women's lives if they have this BRCA mutation, and we have to remember this mutation affects men as well, so this is not just a female issue.
Absolutely. I think Jolie said that also in her op-ed, that, you know, it puts things in perspective. It really makes you think about what matters in life.
Absolutely.
Dr. Jennifer Ashton, thank you so much. Rene Syler, thank you for sharing your personal story with us. You can keep up with this story in real time by downloading the ABC News app and storing the story for exclusive updates on the go. I'm Carolyn Costello in New York.